Hank, are you there and ready to go?
Thank you, Marty.
I'm here and ready to go. I think that hopefully this isn't overly rushed. I have a hard cutoff talking to the NIH, the CDC, and the FDA in a few minutes, and so
And
I
can
thought
you
we were
do a
going to be
quick
starting a
intro
little
of
sooner.
yourself?
Sure, I'm Dr. Legere. I'm the CEO and
Can you do a quick
founder
intro of
of.
yourself, Hank?
Can you not hear me? Hello?
I hear you perfectly.
Okay. Yep. I'm Dr. Henry Legere. I'm
We
the
hear you.
founder and CEO. I'm Dr. Henry Legere, the founder and the CEO of Reliant Diagnostics and our product platform, MDbox. By training, I studied chemistry and economics at the University of California, Berkeley. Went to Columbia University in New York City for medical school and did an immunology fellowship at Harvard, Brigham and Women's Hospital, Mass General. Worked in the special testing lab at Mass General Hospital. Started the immunology division at MIT Medical. And for the last 5 years, have been developing this platform that's an integrated telemedicine solution with remote patient monitoring, integrated with Bluetooth medical devices to allow us to do on-site employee health exams with the same quality and detail as you would get on-site in a doctor's office. So with that, I'll actually share my screen and I'll show you what our existing platform looked like just prior to COVID happening, and then how we quickly adapted to make use or to respond to the COVID crisis. So we were already in freestanding pharmacies. We had contracts signed with Walmart, with HEB, with Kroger's in the Northeast, with Ahold Delhaize, which is Stop and Shop, Giant Martin Eagle. In the Southeast with Southeast Grocers, which is Winn-Dixie, Bilo, Frisky Moss, Harvey's. In the Midwest with Myers, Schnucks, Pioneer RX, 4,700 independent pharmacies. So all told, by the end of 2020, we had a launch calendar just based on signed contracts to be in 23,000 locations. And so think Minute Clinic, but 10 times bigger. And basically, we had already created visits for sore throat, cold and flu, UTI, pink eye, host of other visits, as you can see, plus a general visit type, which was just ask a doctor a question or just get a medication refill. The platform itself is all custom built. And so we have about 10 awarded patents, 8 licensed around various aspects of machine vision, artificial intelligence, and healthcare. We've integrated with both TytoCare and Validic. That puts our total number of Bluetooth integrated devices at about 120 between those two integrations. So diabetic one-touch monitors, blood pressure cuffs, smart scales, pulse oxes, smart stethoscopes. It would allow us to basically capture all of the data that you would normally get in a doctor's office, so that when somebody's doing a telemedicine visit, it's not simply a phone call and a triage, but it's a higher level visit that the providers actually have the same type of information to make medical decisions. Similarly, we integrated with test kits as well. So we started as a test manufacturer with my immunology background, and then we realized that we can make some of our own, and we do have some of our own, especially in the allergy atmosphere. But what we wanted to do is make sure that we also could integrate with any other device that was out there. And so these are FDA approved devices. This is an Israeli company. They've only integrated with us, Teladoc and American Well. They allow people to buy it on Best Buy. We sell it ourselves. And so consumers from home can have medical grade images of the eardrum, heart and lung sounds, images of the back of the throat. But then again, we've also integrated with rapid strep tests, flu tests, serology tests that you're hearing a lot about in the press for COVID-19. We have pre-sold about 4 million of these. We had our first shipment of 50,000 that went through FDA inspection and FDA authorization. And those we just distributed yesterday to the Virginia National Guard, the Texas National Guard, and the state of Texas. And so prior to COVID happening, this is what would have greeted you on April 1st in about 1,200 locations across the country between Kroger's and Walmart's and HEB's in Texas. This is all delayed now post-COVID. And let me actually, I think the most powerful thing is to show you what we did to adapt to COVID with remote patient monitoring. and then to jump right in to a live demo. So right now we allow people to, on their phones, to basically register for in-home monitoring for free. So in the states that we are presently serving, and it's about 12 states, Texas, New York, Florida, Pennsylvania, a couple of big states, and then some smaller states. And basically you register by entering your cell phone number, creating a user account. And then once you've done that, you just get a daily reminder to check in. So we text you. And all we're doing is we're logging your temperature and symptoms. And based on that, we create different levels of triage. Either stay home, stay safe, just adhering to the NIH and CDC guidelines. We have calls with them every single day. Dean Metcalf, who's the head of the NIADH, sat in the same fellowship chair that I sat in at Harvard, but about 30 years ahead of me, and he answers only to Dr. Fauci at the NIH. And so we also are separately going through an FDA approval process to link our machine vision platform and these COVID serology tests to put them straight into people's homes. We're hoping to get that fast tracked and have that authorization for the next 6 weeks. And that really will be the test that ultimately will get America back to work, because we'll be able to demonstrate that people have demonstrated
Hey, your screen seems to have frozen a little bit.
Oh, sorry. I think that maybe what's happening is a bandwidth issue. So are you guys able to see the screen that says recommendations?
No, it just says MDbox, why us?
How about now? Let me see. Let me just stop and resume. And actually what I'll do at this point, rather than showing deck, I'll have demo, it's more powerful. Okay, so the first thing I'll show you is I've already created an account. So this is the kind of text you get on a daily basis. You can see every morning at 8 in the morning, I've been getting these reminders. So I go ahead and log in. And the first thing it's telling me is if I'm having a life-threatening emergency, call 911. And this shows the states that we support. So some big states, Texas, Pennsylvania, New York, Florida, but Illinois, but also some smaller states. And then it jumps right into the symptomatology. So this was compiled through information that we get from the WHO, the NIH, and the CDC, and our expert panel, our medical directors and chief medical officer. So fever, cough, shortness of breath are the most common, but you probably also heard that early on you could have a decrease in your sense of smell. So I'm going to go ahead and just choose fever just to show you what this looks like. And I'll categorize it as mild. I'll say that I've had it for a couple of days and that it's getting it's the same. So I want to show you that we also just tell people to stay home and continue to monitor. We're not putting everybody into a telemedicine visit. We're not putting everybody into a testing situation. In the last 24 hours, we screened about 5,000 people or monitored about 5,000 people just in Austin. We're going live Wednesday with 300,000 people in Hayes County. But of those 5,000 people, we've actually only tested about 200 because most of them could be monitored successfully from home just on our platform. So I'll say no, no. And then my weight 165, do I have a thermometer? Yes, so then I put it in. If it was no, then I don't have to have it. Same thing with blood pressure cuff, I'll say no. Pulse ox, I'll say yes, I do have one and it's 99%. And so you can see immediately it's telling me stay home, continue to monitor symptoms. We also will send out a text and an email that gives them general information about epidemiology, cases in the local community, what they can do to stay healthy. But then at any time, if they want to speak to a provider, they can just click to open the app and they can log in. And this is actually the live environment. So I'm going to log out of this and I'm going to go into the staging environment that looks very similar and show you a live demo of how we do what we do. So right now we're available in both the iOS App Store and the Google Play Store. The plan was for us to be in 20 states by the end of Q1, 40 states by the end of Q2, and all 50 states by the end of Q4. We're somewhat accelerating and somewhat decelerating just based on everything that's going on with COVID. We'll be in more states sooner, but we probably won't cap off and be in all 50 states until we're ready to. There's just some states that are so small in terms of patient population and managing those provider networks is such a hassle that we'll concentrate on the big states. We right now
Hey,
have
Hank, is
contracts.
the app under MDbox
It
under
is,
these in iOS and Google?
it is, yep, just MDbox. And you
Got it.
see, we support family accounts. And so I've set it up with a bunch of hypothetical children. And the reason is that different ages and genders can do different visit types. I'll do a visit for myself and I'll show you. I'm not eligible to do a UTI visit. That's for women 12 and up. I can't do a birth control visit. That's for women 16 and up. That actually varies state by state. Your phones are geotagged, so we know where you're at. In California, a woman is entitled to any option of birth control at 12 and up. In Texas, at 16 and up. So we've worked with Jones Day on a state-by-state regulatory roadmap, and the app reflects that. It's behind the scenes on the back end. So my phone recognizes I'm a man, and so there's certain visits I can do. So I'm going to go ahead and do some overlapping symptoms on a flu visit, and I'll show you how we still screen for COVID. And then I'll actually do a live test. And so this is set up with a paywall that looks a little bit different from the live environment. This is just purely a demo environment. The first time you create an account, it has all the normal medicalese where you've got to sign the paperwork, you've got to digitally sign with your finger on the screen that you've read our consents to treat, any of the privacy policy information, and that you're establishing a patient-provider relationship with our practice. I've already done all of that. It also asks you all of the, the basic input. What's your past medical history, social history? I'll just quickly run you through that. You can see it's a very detailed list, mostly alphabetized, but at the end, you can still freeform type anything you want so that your provider will ask you about it. So our providers are doctors, nurse practitioners, PAs, fully licensed and credentialed in each state. Same thing with surgical history. Medications and allergies, we've integrated with a pharmacopeia. So it has predictive text. You just start typing and it predicts what you're going to say, and then you can select it. It's very easy to onboard your medication list. And also things like allergies. So you just start typing it. They're recognized as food allergies, but you can also put in nonsense stuff, and then your doctor will ask you about it. Social history, language preference. We support English and Spanish. If the carrier settings on your phone are in Spanish, then all this text would be in Spanish. But even if the carrier settings are in English and you prefer a Spanish-speaking provider, you just push the Spanish button and we'll match you to a Spanish provider. The contact information, emergency contacts, pretty standard. Who your PCP is. If you have that information in the fax number at the end of this visit, we automatically send them a fax with your permission. I mean, you have to give us permission to do it. If you don't want us to, we won't. And some people don't. With some of our STD screenings, they might have a 20-year relationship with a primary care doctor, but they're doing a herpes test. And if the herpes comes back positive, they may not want their PCP to know it. It might mean that they had an infidelity, something happening. And so we protect the patient privacy. The phones are geotagged, so it searches out your preferred pharmacy is always listed first, but then geographically it searches out preferred pharmacies that are nearby. We've done a SureScripts integration, so it has 99% of all the pharmacies. This is just the demo environment, so it's only just pulling, one from California, one from Pennsylvania, just showing that we've done a complete SureScripts integration. But in truth, if I was standing in downtown Austin, I would have 50 probably within 2 miles of me that would be popping up here, and it's just geotagged. And same thing with lens status. It's a detailed questionnaire for that. And then if I had no new updates after creating my primary account, this is where I would begin. So I would jump right in. It remembers my triage symptoms, but now it's exploding into more detail. When I built this platform, I wanted to make sure that I was building a platform that was cost effective, price transparent, and truly could increase access to people. You don't have to wait weeks to get in to see a doctor or a specialist. But I didn't want to compromise the quality of care. So these questions right here that I just checked, those are basically probing for other types of disease. It could be fever of unknown origin. That could be indicative of certain types of malignancies, certain types of autoimmune processes, autoinflammatory conditions. And so even though it seems like you're doing a little simple telemedicine visit, there is thought that's going into looking for more complicated processes. And then cough, 3 days, getting, I'll say worse, and I'll say it's productive, and then
Hank,
I'll
when you talk
characterize
about
it.
price transparency, what does that mean exactly? Price
That means
transparency. Are you
single cash
charging
price. Yep.
people, or is
Yep, exactly. Yeah. So when you actually see the paywall, there's a single price that we charge for the test plus a visit, or just the single price for a visit, but you're not getting billed later for it. Now, we do in certain locations and certain models take insurance. So when we're working with employers, we are working with their third-party administrator, and we have pre-negotiated fees. And then there are some, we're working with Medicaid in Texas, where we basically, right now, there's no copays for any visit in the state of Texas, and probably nationwide with Medicare and Medicaid during the crisis. And so we'll just process people's insurance. But then again, we explained to them there's no bills coming. So price transparency means is you're told up front what you're going to pay, and you don't pay anything more than that in the long run. You can see that even though we initiated this as a flu visit, we're screening for things like coronavirus. So I'll say, yes, I was exposed. I don't know their test result. And then recalls the flu, and I'll say I haven't traveled outside the United States. I have been in a region that has coronavirus. We all have. And then a complete 12-point review of systems, what you've already tried medication-wise. This is recognizing your symptoms. So if I had put in urinary symptoms or pink eye, I would have a different list here. And these are contraindications to tests. And so the testing that we do right now is done on site at either partners that have subscribed to our software. We have different models. We allow people, doctors that don't have a telemedicine solution, could just license our platform, and then they can be the ones that are actually on the back end staffing these visits. They typically will clock in between 8 a.m. to 5 p.m. and then our telemedicine providers cover their overnight. We also just function 24/7 on our own platform. So if you were to just download the app now and initiate a visit, you're seeing one of our providers. If we need you to be tested, then we tell you where you can go to be tested. So typically we're setting up pop-ups in various big cities where we're doing coronavirus testing. Prior to coronavirus and after coronavirus, we'll be doing these types of things inside of pharmacies that we partnered with. So it'll be a Kroger's, it'll be a Walmart, it'll be a Giant Martin or a Stop and Shop or a Winn-Dixie, but it'll be through the pharmacy that most of these tests take place, or it'll be at your employers. These are the contraindications to doing a nasopharyngeal swab. I've gotten a flu shot. You can see that by the time that I've entered in information, and if I hadn't been talking, this would have taken 5-10 minutes max. I want a copy of my note sent to my PCP. I want a return to work note, return to school note. Obviously, in the context of COVID, this is not sending me back to work or school anytime soon. And now I can jump into the visit. Do I have a test with me? So I'm actually at one of the sites where I can do the testing. Take test, screen by screen instructions.
Hey, this looks really great. I was hoping that we could talk a little bit more about the economics of this.
I will.
And about a case study of like your working relationship with like Walmart, things like that.
Sure, I'll get into that. Let me just finish this real quick. And so you can see that we make it very easy to actually capture the information. The technology itself has a very sophisticated auto capture. It's capable of recognizing pills by size, shape, colorings, markings. To date, we've raised about $13.8 million. It was a very large seed round. We still have about half of that in the bank, and we're in the middle of raising another $40 million. And we've had the first $3 million of that fund just this week, but we're hoping to close that in the next couple of weeks. So now this patient's in a virtual waiting room, and let me go ahead and stop sharing that. I just want you to see the AI and then the machine vision, and I'll get more into the financials, and then I'll probably have like 5 minutes to do that. So screen share, and I'll just share my overall desktop, and you should be seeing right now, log into the AI engine that's called LabTrack. This is where we do all of our analytic studies with the FDA. So all of these studies are various FDA submissions. This is the catalog. This is the last test we just took, and we can see the artificial intelligence has an interpreted as true and true. So it's telling me it's a double positive on a flu test. I'll log out there, and I'll log into the provider side and just show you that. I've got a patient now that I put in the virtual waiting room.
So can you talk about when you sign an agreement with like Walmart or something like that, are they co-promoting it with you? How does that work?
Oh yeah. So I think I showed you in that deck a life-size, oh, maybe you weren't able to see it, a life-size poster of me that would greet you in every one of those pharmacies. That was all set to go out on April 1st. And so here is a explosion of the patient demographics, the COVID risk factors, everything that the patient put in can be quickly changed by the provider. I'll start the video and I'll quickly end it so you can see the concept of a two-way video with your provider. So, hi, I'm Dr. Legere. I'm your telemedicine provider. And it's already HITRUST certified, and these are meaningful use compliance check marks. Our diagnosis engine, we basically created an AI engine that will predict the diagnosis and makes it very easy. That generates a note. The AI is also sending by email NIH guidelines for each of these conditions. No PCP follow-ups required. This is our coder. So it's integrated with insurance. I just want to show you that one last thing and I'll dive into the financials. So this is the level of the detail of the note that I'm quickly scrolling through. Medicare, Medicaid, any of the private payers, it's extraordinary detail, including a picture of the test results, and then the face-to-face video time, and the E&M code, the modifiers, and the procedure. All of that gets bundled and sent to the billers so that the providers don't need to do that. Now I'll stop sharing and just get into the financials and answer those types of questions.
Just real quick, also another question, Hank, is how quickly were you able to repurpose the app? I mean, obviously you had a fully functioning app, et cetera, and then all of a sudden,
it takes us 2 days to take any one of these lateral flow chromatography type tests. This is actually a COVID test I'm holding up to my screen right now, if you're able to see it. I'll actually screen share here, start video. So that is a 2-parameter COVID test. It took about 2 days, 10,000 images. We have a machine vision lab. We have about 40 employees on site there in Austin. And so they basically, under various lighting conditions, we're able to collect all the images we need to train the AI. Once we train it up with about 10,000 images, then it has about 99.5% accuracy.